Healthy eating pattern is about consistency, choosing healthy foods and beverages. Simple rule of healthy eating is, emphasizes fruits, vegetables, whole grains, dairy, and protein. Less sugars, less bakery products, less smoked products, avoid saturated fats, and decrease sodium. Protein recommendations include seafood, lean meats and poultry, eggs, legumes, beans, peas, and lentils, soy products, nuts, and seeds. Fruits and vegetables are most important because of dietary fiber composition and vitamins and minerals. Fiber helps maintain digestive health and helps us feel fuller longer. Fiber also helps control blood sugar and lowers cholesterol levels. Fresh fruits and vegetables, whole grains, legumes, nuts, and seeds are good sources of fiber. Almost all fruit is healthy, especially a pear, apple, melon slice or passion fruit with meal or as dessert. Increase calcium and vitamin D. Calcium and vitamin D work together to promote optimal bone health and many vital processes. Add more potassium. Potassium helps the kidneys, heart, muscles and nerves function properly. Not getting enough potassium can increase blood pressure, deplete calcium in bones, and increase the risk of kidney stones. Limit added sugars. A pitcher of water with lemon. Too much added sugar in your diet can contribute to weight gain, obesity, type 2 diabetes, and heart disease. Some foods such as fruit and milk contain natural sugars. Added sugars are sugars and syrups that are added to foods and drinks when they are processed or prepared. Added sugars have many different names, such as cane juice, corn syrup, dextrose, and fructose. Colors of vegetables and health. Fruits and vegetables like dark, leafy greens, oranges, and tomatoes have more antioxidant and vitamins compared to other vegetables, so, roughly the darker is the vegetable or fruit it is the better for health.